My name is Jackie Campbell. I'm from Johns Hopkins University School of Nursing, and I'm also a proud member of the ICOE board. And I want you all to do something for me. Before you leave this wonderful conference, to which we owe much gratitude to Dr. Afaf Malis, who has really put all of this together, put the effort behind it, made all of us on the planning committee have frequent conference calls. We all worked very hard, but she worked tirelessly to put this together. And one of the things that we need from you is to be sure and join ICOE. And there's a pamphlet right outside these doors, looks like this. Grab one before you leave, but grab 2 other ones, and when you go home, tell your colleagues. Get at least 2 other people to join this wonderful organization to make sure that we stay viable. And then the other thing I want you to do for me, as part of your membership, you will get a subscription to Healthcare for Women International. It truly is a wonderful journal. It's one of the few journals that really publishes research from all over the world, from women who care about health for women. It's a high impact factor journal, in case you're worried about that, those of you around here that have to count those things. But more than that, the research that's published here is both qualitative and quantitative. It is incredibly rich. And it's research that you're going to want to keep track of, and having a subscription helps you do that. And all of you who gave the wonderful posters and presentations, please get your work published in our journal. And if English is not your first language, or this is the first time you've tried to write a scholarly article, get in touch with either the editor or any of us that are on the board, and we'll help you shape that article to make sure it does get published. So please do take advantage of this wonderful opportunity. And if you haven't done reviews before of journals, we need reviewers. So get on the journal review, and you learn so much by doing reviews. Now, my real job this morning is to introduce the important people who will then introduce our speakers. So our first introducer is Rosemary Greco. She's the current chair of the Board of Overseers of the University of Pennsylvania School of Nursing, for which I know they are very grateful. She serves as a senior advisor to the Governor of Pennsylvania Healthcare Reform. Ms. Greco was the first director of the Governor's Office of Healthcare Reform for the Commonwealth of Pennsylvania from January 2003 until 2008. Which was aimed at improving access, affordability, and quality by rejuvenating Pennsylvania state government's approach to health care. Greco is best known for the driving force behind the governor's prescription for Pennsylvania health care reform plan. Besides that work, that incredibly important work, she's also a director on 5 corporate boards. So those of you that are not yet on a board, talk to Rosemary about how you position yourself to do so, to get women's voices on these important boards. Rosemary.
Good morning, everyone. I heard you had a wonderful celebration last night, and I understand that there are people sort of trailing out of their rooms here, and so we might have a full room very soon. I am delighted to be here today. I know that most people who address groups say something similar to that. You know, I'm so happy. But let me tell you what's behind the delight. First of all, as Jackie noted, I have the distinct privilege of being on 6 boards, 5 in the public sector, large corporations, and the School of Nursing here at the University of Pennsylvania. The School of Nursing at the University of Pennsylvania is my most prized possession. chairing this board and being part of the extraordinary and dynamic team led by one of the leaders in your world and the leaders in the overall overarching world of health, Dean Afaf-Maliz. I call her my dear Dean. And in that respect, though she refers to me as her boss, in quotes, there is no such thing. There is no such thing. No one in this universe could possibly undertake the challenge of the dynamo Dean Afaf-Maliz. The team that surrounds her is committed, focused, and absolutely embraces all of the tenets, not only of this university, but also of health, caring for the world. I am not an alum of the University of Pennsylvania, which makes my position as chair of the board quite unusual. But I am a Philadelphian, born and bred, and I have remained here, fortunately, throughout my entire life through education as well as through my career. My career is in the world of banking. I actually started out as a branch secretary when I desperately needed a job to continue my studies. I wanted to be a teacher, and I had a few more years to go to school. And I thought by getting a job in the work world where they actually paid a decent salary as opposed to remaining in my world of education, that I would be able to finish my degree sooner rather than later because I could afford to. And the end result was I stayed in banking my entire career, but I never ever felt that I was anything less or more than a teacher. I believe that each of us is called to enable others, to empower others. You know, you can't make someone able, even in teaching, but you can enable. You can't grant someone power, but you can expand the horizon whereby they feel empowered. And those lessons that I think were embedded in my original intent to be an educator led me through to several positions of wonderful prestige, including being the CEO of the 18th largest bank in the United States, and there at the time were 2,300 banks. In that role here in Philadelphia, the lessons that I learned are the lessons that I think we know intuitively, but get a chance to express sometimes when you're in a position of leadership that you don't get to express when you're not. But the lessons were that we are all inextricably linked one to the other. That in a flow of work, in an expression of professional work, in an expression of joy, and in an expression of compassion, poverty, illness, injury, death, we are all inextricably linked. I have the distinct belief, some may call bias, that this is embedded naturally in women. And many men, thank goodness, have acquired this leaning, if not instinct. Your work and your focus on the health of women is really the critical success factor for everything that is socioeconomic at every strata. So to enable women, to empower women, begins with their physical and mental well-being and extends to the protection of their rights, the enablement of their capacity as family caregivers, be they children, their parents, their husband, their husband's parents, the community at large. Dr. Amy Gutman, in her address the other day, noted that women are really at the core of change, evolution, and opportunity. So your interaction, your interlinkage, is critical not only to the health of women, but to the health and well-being and capacity for all people to achieve and reach their fullest potential. So that's why I'm delighted to be here. That is why I'm delighted to be here. We have an event that is coming into Philadelphia in October. The Dean is very much part of that planning. We are hosting 102 women delegates, 2 from every state in the Union, as well as from Washington, D.C. The delegates will come to an event called Vision 2020. And for anyone here who thinks that's about ophthalmology, in some ways it is. It's seeing equality in sight is our tagline. 2020 will be the 100th anniversary of the passage of the 19th Amendment to the United States Constitution. The 19th Amendment gave women the right to vote. The suffragists who fought for that right did not simply have the right to vote as the end outcome. Their vision was that the right to vote would position women in every strata of public policy, professional worlds, and decision-making. That has not been realized 90 years later to the degree that it must and should for the common good. It's not about quota, goals, numbers. It's about influence and expansion. It's about honoring the inextricably convinced link one to the other. And so for the greater good of this country and then the world, because we do intend to take it internationally, we're sort of trying to get our own house in order, Vision 2020 will work for the next 10 years on that particular objective. So by the year 2020, our expectation is that we will have moved towards, continued the journey honoring the suffragist of 1920 and realize the vision of women being at the table with a voice in every strata of socioeconomic environment. So we welcome your organization to participate in that effort as well, and I'm sure that Dean will share with, Dean Melise will share with Trish that objective, and perhaps you'll hear more about it at next year's conference. I'm going to stop here and ask my dear Dean what other dancing she would like me to do while we're waiting for Don Schwartz. All right, wonderful. Well, you'll very much enjoy meeting both the Deputy Mayor, Don Schwartz, and our Mayor, Michael Nutter. Don is a scholar and a clinician and is very pedigreed in terms of his studies. His MD, his Master's in Public Health, is from Johns Hopkins. His Master's in Business Administration is from the Wharton School here. He has served as Chief of Divisions, Vice Chairman of the Board of Pediatrics at Children's Hospital here in Pennsylvania, Philadelphia. And he left his position, including 22 years as a researcher, specializing in pediatrics and adolescent behavior. He left that position to go to be the Deputy Mayor for Health and Human Services and assisted living, housing for Philadelphia. So we are very privileged to have him in that role. I will tell you that moving from the academic sector or the private sector or the public sector into the government sector is extraordinarily challenging. It too is rooted, the success is rooted in enabling and empowering everyone around you and leading to a vision that is so compelling that even those who don't want to go there are dragged along. So that's the work that Dawn does here in Philadelphia. I'm going to end my remarks with just one huge congratulations to all of you for the sharing and for recognizing that indeed we are all accountable and all inextricably linked for the welfare of everyone through women. Thank you.
Well, I'm going to step in for Don and get to do something that I was hoping I would get to do anyway, and that is to introduce our major speaker, who is a friend and colleague of mine. Oh, J.A. is going to do that. All right. I will introduce J.A. Gresso then, who is also a friend and colleague of mine. That's all right. And J.A., I had the pleasure of working with her. First of all, you need to know that she contributed one of the major research studies on violence against women a long time ago that really changed the map. She showed that young women here in Philadelphia who came to the emergency department, who were asked, "What happened to you?" and they said, "I fell," because that's the easiest thing to say, that actually they were there because they were the victims of violence, and many times intimate partner violence. And that was one of the articles that really did change the map, really made a difference. She went from here, to Robert Wood Johnson Foundation. And at the foundation, she spent 7 years, and she truly transformed the foundation in many fundamental ways, two of which I'll mention. For the first time, she got the foundation to pay attention to violence, to fund initiatives around violence. And the other thing she did with me was create the Nurse Faculty Scholars Program. And there's also flyers about that program outside. AFAF is on our National Advisory Committee. And what we're trying to do, and so is Nancy Woods, for that matter, who just came in, what we're trying to do is give research funding and leadership training to young nursing faculty. And so if you are either a young nursing faculty or mentoring some up-and-coming nursing faculty, please do talk to us, take one of those flyers. We're really looking for stellar applicants for that program. Fortunately for the University of Pennsylvania, J.A. is back here, and she's one of the few physicians who says proudly, "I'm a professor of nursing, public health, and medicine." J.A.
Thank you, Jackie. I was just saying to her, in all her remarks, she's a mentor. She's always trying to make women achieve their success, potential success. If we have a little extra time, I'd like to just say one thing from my heart, and that is I could not imagine meeting, one doesn't meet many leaders in one's life who are extraordinary, who really touch the hearts of everyone and moves the world. And that leader sitting here in a purple outfit, her name is Afaf Maliz, and I just want to give her a hand because she has been just incredible to me and to every one of you, I suspect, and she's just an amazing leader. Thank you. And I also am thrilled to introduce Dr. Claudia Garcia-Moreno, who is a physician from Mexico, and then she traveled to the London School of Hygiene and Tropical Medicine and studied and got a master's in community health. And then she went all over the world working on the issues of women, and particularly women and violence. And 15 years ago, she started her work at the WHO, where she carved out programs that had never existed before, including she started this incredible study that involved 14 different countries throughout the world for the first time ever to document
the women's experience on a population basis of intimate partner violence. 30 to 60% of the women had never even been asked and had never told anyone across the world. What she demonstrated was that there was an extraordinary high prevalence of domestic violence in every country, and the results, which have been published everywhere, have had a huge impact in countries in terms of legal and policy reform, in terms of health professional education, and in terms of all different ways of understanding and validating the problem and helping it to become really finally recognized as a major issue. Claudia currently leads a team that work on gender issues generally, reproductive rights, sexual health, and adolescence, as well as violence. So it's a credible team of pulling together all of these issues that are so linked. She was just a couple of weeks ago in Swaziland working with the Minister of Health to develop a program for post-rape care. I mean, this is just an example of all the different kinds of things that she pulls together in her work. She's starting a new program that will be in Mozambique and South Africa and Malawi, and it's going to focus on how could one actually, in those low resource settings, screen for intimate partner violence and then do something about it. In those settings, it's not easy, and it's not really been developed in terms of the models that have been developed, for example, in Texas. So she's going to be, again, a pioneer in her efforts. I want to say one thing personally about Claudia that exemplifies her spirit. Once I was with her in England on the fields where there were sheep and lots of wind, and she was flying a kite. It was a big kite, and the wind picked her up off the ground into the sky. And what would you do if you were in that position? Would you let go? I would let go. Let the kite go to the stratosphere, right? But not Claudia. She wrestled that kite back to the ground, and that's exemplified her work. She's fought every struggle. She's stayed there despite the huge powers that have that she's had to challenge over and over again in every setting, across countries, across governments, across healthcare, and she has accomplished what I think few women before her ever thought they could accomplish. So it's a pleasure to introduce Claudia Garcia-Moreno, giving our keynote this morning.
Thank you very much. Thank you, Jay. I had not remembered that incident in a long time. And I want to also just add before I begin that there are many people in this room that have been pioneers in the issue of violence against women that I have learned a lot from, that have been a great source of support. People like Jackie, like Judith, like J.A., and have really informed and supported the work that we have been able to do internationally. So thank you very much. Like everybody, I would start by thanking the organizers for getting me here, for involving me in this. I'm really delighted to be here. And I've also learned an enormous amount, firstly by preparing the presentation, and then also just from what I've been hearing. And in the last 2 days, I think all of the speakers have been tremendously inspiring, and I hope that some of this we will take forward together. My presentation is going to start with just some general issues related to women, cities, and health, and particularly how we bring the attention to women's specific needs, and then look specifically at the issue of how do we make cities safe for women and girls. This year's World Health Day, which was actually this Wednesday, 7th of April, is World Health Day, was on urban health. And WHO has marked 2010 as the year to focus on urbanization and health for reasons we have all been hearing about in this meeting. For the first time in history, the majority of the world's population is living in cities, and this trend will continue. Part of the launch of this World Health Day included a focus on 1,000 cities, 1,000 lives, trying to get cities around the world to take action multi-sectorally, to do things to promote urban health, and to identify leaders in urban health that are doing things in their communities. And I hope that there will be at least 30%, if not 50% of women among those, but I will not be able to tell you that until that campaign gets off the ground. But it's always a challenge getting the women's perspectives into all of these campaigns. This trend, as I said, will continue, and most of the future growth of cities will be in low and middle income countries. By 2030, it's predicted that 6 out of every 10 of us will be in an urban setting. And part of this is the natural growth of demographic growth of urban populations, but another big chunk is the migration from rural to urban areas. And one specific issue about that is that over the last 20 years, a very large number of women, young women from rural areas, ages 18 to 24, have come looking for work to urban cities. So in many cities in Latin America and in Asia, the young adult females outnumber young adult males. And another feature of cities is that there is a very large proportion of young people, adolescents and young people. In many African cities, more than half of the population is under 19 years of age. And I think in terms of some of the issues that we work on, and reproductive health that has and mental health, that has huge implications. Cities are a place of opportunity. People come to cities because in search of better jobs, better incomes, employment opportunities, better access to services. But what we are seeing is really a growth of an exponential growth of unplanned, unhealthy urban sprawl in many countries, with inadequate housing, without sufficient water and sanitation and other facilities. And this has obviously enormous implications for health, starting from exposure to air pollution, to waterborne diseases, to road traffic injuries, and including issues. And then, because the services are not keeping up really with the growth of these urban populations, when people cannot move easily, they cannot access healthcare, they cannot access jobs, and what we are seeing is also a whole range of secondary health effects related to lack of physical activity, obesity, mental health problems, etc. And I won't go into any detail on that. This map was shown by Dr. Pin yesterday. Basically, it shows that a lot of the urban expansion is in slums and informal settlements, and this shows that those informal settlements and slums are primarily located in Africa, Asia, and Latin America. And again, an interesting feature is that about a third of households in these poor urban areas are headed by women. And we know that the urban poor have, of course, much worse health than those living in other conditions. I'm not going to go into these issues, but just to basically flag that whatever we're doing, whatever issues we're addressing, whether it's water and sanitation, housing, transport, safety, we need to make sure that we understand the specific needs and considerations for women. And this is one of the challenges that we see with a lot of policies, that they really don't look and address at the specific concerns for women. So I'm going to just briefly give a few examples. In relation to sanitation, approximately more than 170 million urban residents have no access to even the simplest forms of latrine. So they are forced to defecate in the open, and this clearly for women and girls is very problematic. It means that often they may delay, they may only go out at nights, and therefore be exposed to other issues, particularly violence and safety issues. In relation to water, although 90% of households in urban areas have some form of access to improved drinking water sources, many of these are not on the premises. So it means long journeys to the neighborhood water points, long waits, trips back carrying heavy jerry cans, and a lot of these responsibilities and tasks often fall on women and girls, in addition to the risks of contamination and water vector-borne diseases and other problems. Access to services is another big issue for women. And this is data from India. And what it shows is that if you compare just the rural average and the urban average, it appears that urban populations have much better access to maternity services. But when you actually look at the urban poor, really their access is not very different to the rural populations. This slide really illustrates the same thing in relation to health facilities. And for women, these issues of access to services are related to cost, they're related to transport, they're related to access to the services, both also sometimes language or cultural issues, gender barriers that may not allow them to seek care. So all of these issues need to be taken into consideration when we're looking at how addressing the issue of access. And we know also that the quality of the services that the urban poor have is much lower than that others can access in the same cities. So I'm going to move now to issues of safety and security. And what does it mean for a city to be safe for women and girls? A safe city is one in which all of women's rights are guaranteed. It is one that promotes the elimination of gender-based violence, while at the same time promoting equal opportunities for women in terms of access to economic resources, political participation, education, employment. It's a city where the spaces are safe for women. It's been shown that spaces that are more intensely used by diverse people and for different activities are safer for everybody, including women. If there are more people on the streets, there are more eyes on the street, it's less likely that crime and assault and robbery will occur. And in order to promote spaces that are well used and diverse, then there needs to be attention to the environment, and I'll say a little bit more about that, issues of lighting, and many other things that influence the safety and the use of public spaces. Why is this important? Firstly, women and why is making cities safe for women and girls important? I mean, firstly, women and girls experience situations of violence that are different from those that are experienced by men. Women are harassed in streets, in parks, in schools, and when they use public transport. They're exposed to rape and other forms of assault. And this omnipresent violence or fear of this violence, including in the home, is kind of compounded by fears of being victims of robbery and other forms of crime. And it leads to women modifying their behaviors and their use of the public spaces. And just to give an example, a study in Montreal in Canada in 2000 showed that 60% of women reported that they were afraid of walking alone in their neighborhood at night compared to 17% of men. And sexual abuse is one of the main reasons that women cite for fear of being in the streets in cities. So this perception of insecurity and the real insecurity impede women and girls from fully using and enjoying the city and enjoying public spaces. And it contributes to women being seen as vulnerable, and it makes them victims of fear as well as of the violence itself. And these issues are often not taken into account in urban policies and planning. And even programs that are targeting urban violence tend not to really address the specific concerns of women. So, you know, at the risk of sounding like a broken record, you know, we really, need to make sure that a gender analysis is done when we're looking at these policies. Making cities and communities safe for women also contributes to their equal opportunities, contributes to their ability to access services, to access jobs, to be able to move from place to place freely and to participate more actively in politics and in recreation. And it also, by addressing these issues, it raises attention to, for example, the connections between the violence experienced in the private sphere with violence in public spaces. It brings it recognition that violence is an obstacle for the development of communities, that women's independence and participation in community life is important, and it also brings attention to the needs of different groups in addition to women, the elderly or disabled people, by bringing more attention to this disaggregation of populations into more specific groups. Now, what are some of the challenges? I mean, the perception and of insecurity, and the insecurity is related not just to crime and violence, but really to a whole range of other factors, and these need to be addressed. Criminal activity in general. Women are also often target of street and home-based robbery, and female victims are more likely to be experience sexual abuse than male victims. Sometimes in situations of gang violence, violence against women can be used as a way of fronting the men of the opposing gang, for example. So clearly that's an important issue. Poverty and inequality results in increased exposure to insecurity and to the risk of experiencing violence, but it also isolates women, and it sometimes doesn't allow them really the social support networks that they need when they do experience this violence. A couple of examples. I mean, a woman in a poor urban slum is more likely to have to cross through unsafe parts of town, through places that are badly lit, or she may have to wait for transport in places that are not safe. And all of that is related to poverty. A woman that works, in the market and has to take her produce early in the morning and has to rely on unreliable public transport, sometimes with children or waiting in unprotected sites. So poverty contributes in many different ways to this vulnerability. Services may be inaccessible due to distance, lack of affordable transportation, I've already mentioned that. Lack of housing, it contributes to women not being protected, and also does not, works against women being able to leave an abusive situation. Governments that are inaccessible and where decision-making structures exclude the participation of citizens, and particularly women, are unlikely to then be able to reflect and address the specific needs of women. So this new trend that we are seeing towards involvement of civil society with local governments to find solutions, we need to make sure that in those processes, diverse groups of women are included. Where there is organized crime, sometimes the poorest women become vulnerable to both recruitment into criminal activity, or also sometimes to being more vulnerable because they're not protected by a particular group or warlord or whatever it is. Now, what are some of the solutions? Clearly, and it's something that I think we've been hearing throughout the discussions here, the solution has to be multi-sectoral. No one sector is going to address all the issues. It needs a multiplicity of partners, from governments at different levels, services, water, sanitation, emergency services, police, security personnel, health providers, health policymakers, women's organizations, youth groups. I mean, it really requires a group of researchers, academics, media, requires across the board involvement. And the other thing that we find is that sometimes sectoral policies, somebody yesterday talked about breaking the silence. We have a lot of sectoral policies or responses that don't come together. So we really need to look at how do we integrate and really look at the issues in a more holistic way. Now, what are some of the specific issues that can help in programming for making cities safe for women and girls? Firstly, we need to have an understanding of the differences, the different experience of living and working in a city for men and women, and recognize how these differences impact on the use of services, on the access to services, and on the requirements. And I'll say a little bit more specifically about transport, using transport as an example to highlight this. It's important to involve women and girls. They are the ones who know. They are experts on where they feel safe or unsafe and why. And programs need to take this knowledge and value it and use it as a starting point. It's important that to recognize that not all women have the same experience. So we need women of different age groups, different backgrounds, different ethnic groups. And that can help to bring new ideas to the table. It can help to inform how program and policies may benefit or harm women. It can give women a sense of ownership and decision-making over, their own communities, and develop also their capacities in communication. So the whole issue of involvement of women is important, and to make it effective, we need to have certain mechanisms in place. We need to address some of the barriers that women face to participating, and I'll say a little bit more about that. I've mentioned already there's issues of safety, and then there's issues of perceived, the fears, the anxiety. A woman gets raped in a particular neighborhood, and all women feel afraid. So those issues need to be taken into consideration. Gender inequalities in terms of access and control over resources need to be taken into account. And the importance of using and understanding local solutions also needs to be taken into account. So I'm going to just use the issue of transport as an example. Mass transit and urban public health transport is critical to the health of developing cities, and prioritizing urban transport, mass transit systems together with dedicated cycle or pedestrian lanes has been shown to have multiple benefits, certainly in terms of health, more healthy lifestyles, in terms of environment, in terms of bringing people to access to food, to healthy food, and promoting integration and across the cities. However, to benefit everybody, this really needs to address some of the specific issues. Unlike men, women often do not travel from A to B, from home to work. They often are responding to multiple tasks. Their paths may crisscross or zigzag across the city. They tend to do multiple stops and destinations for diverse purposes. They tend to have to travel at non-peak hours, which is when there's usually less availability. And this also has an implication in terms of the cost, because it can involve multiple fares and also expense in terms of time and money if the transport is not available. And that's the reality for the travel patterns of women. And yet what we see is that most urban mass transport is designed around schedules and routes to serve the commuting trips to work. It's to serve mostly the men and not these multiple roles and to that women may have as entrepreneurs, as workers in the informal sector, to travel at off-peak hours, to travel to a multitude of destinations. So programs that are trying to make cities safe for women need to look at these issues. They need to advocate for a wider spectrum of transportation solutions. They need, in addition to motorized transport, to promote issues of, for example, having bicycles. There's these community bicycle shared programs that many cities are beginning to experiment with. And they just need to be planned and designed to accommodate women's specific needs in terms of the routes they travel, the times of the day, etc. Another issue for women is harassment of women in public transport, which is a very real and serious problem in many countries, and it impacts on women's travel behavior. And I was telling somebody yesterday, I grew up in Mexico City, and one of the pleasures for me when I arrived in London to do my MSc, one of the biggest pleasures I had was to be able to walk and use the public transport and not be harassed. And and it's not to be underestimated, the impact that has when you're all walking in the city. I realized at some point that I was used to walk with a growl on my face, like, don't come near me. there's in some of the strategies that have been introduced in some places using greater security personnel, effort not to have overcrowding, women-only carriages or buses, and again, listening to women. There's an example from Pune, India, where women did not really want to have women-only buses. They preferred to have sections for women in mixed buses, and they also asked for more buses so that the overcrowding would be reduced. Another interesting initiative which I thought was very creative, was from Nairobi, Kenya. It's called Adopt a Light Limited, and businesses are encouraged to adopt and maintain a street light in exchange of using that street light for advertisements. And it's a way of ensuring lighting. Another strategy for buses is the request stop programs that allow women to get off closer to their destination at night or early mornings. So different strategies. And just in relation to health, we know that transport is very important. Lack of transport services severely hamper lack of access to health services. And that also enabling women to use intermediate forms of transport like bicycles in some settings has been very valuable, both in terms of access to services but also in terms of empowerment. Another example is this organization called Women in Cities International, which works to increase women's safety by identifying and disseminating effective and promising approaches to promoting women's equal access to public space. They have community dialogues to understand what are the factors that lead to gender exclusion in public spaces. They use focus groups and women's safety audits to help women identify the safety problems and to come up with solutions and partner with local governments. And I'll say a bit about this women's safety audit. This was originally developed by METRAC, which is the Metropolitan Action Committee on Violence Against Women and Children in Toronto, Canada. But it's now been widely used and adapted for different settings. It asks questions about women's safety, and it's also for women to build skills and make their communities more safe. And its three principles are that women are the experts about the insecurity and the safety that they experience. It encourages local and context-specific solutions, and it promotes partnerships between women and local government. And the way it works usually is that it starts with a group of women and possibly other community members coming together in identifying a place that they feel is unsafe. And then it could be a parking of a shopping center, or it could be a pathway between residences, it could be a water source. They identify the place and they go together and do a kind of assessment, usually with a checklist, to look at what are the features that make this unsafe. Is it isolation? Is it negative graffiti messages? Is it lack of lighting? And then based on that, they propose solutions and they partner. And some of the benefits have been, in some places, it's usually initially had a very strong focus on improving the physical environment. And that was the original sort of METRAC work. But it's really expanded so that, for example, in Tanzania, the focus became on socioeconomic considerations, such as access to jobs and, more job creation, increased focus on access to health. In Paris, the focus was on improving public transport. And this is just an example of one little bit related to lighting, but it's a checklist that has been adapted for use in rural areas, in college campuses, etc. But the idea is really around the process of bringing people together, identifying the problem, and then identifying solutions. So this issue of this approach of safe cities for women is relatively new, and I think we still need a lot of advocacy and activism around it, and we also need to build the knowledge. We need to further develop the experience and the knowledge and see what works, what are the benefits. Partnership between local government and women's organization, I think, is proving to be very useful. And UNIFEM has recently started a program in Latin America where they fund women's groups to come together with local governments and do a baseline assessment of what are the forms of violence that the women experience, where, and developing action proposals. And just 2 examples: in Chile, an agreement was signed with the Ministry of Housing to incorporate gender and security issues in plans for neighborhood improvement. And in Rosario, Argentina, and also in India, they focused on media campaigns about women and about the harassment and the violence that women experience while using public transport, and training the municipal police to be able to respond to gender-based violence in public spaces. So it means creating safe public spaces. I've mentioned already lighting, issues of visibility, ensuring there's no hiding spots where people can jump out at you. And yeah, tools, we've mentioned the audit. Last but not least, the involvement of women. I think what we see is that the participation of communities has made a big difference. This is an example from a project in Cambodia called Ban Makong, which stands for Secure Housing. And it's implemented through the Community Organization Development Institute in partnership with local government, with some local academics, professionals, and NGOs. And it started out focused on community savings and credit activities, and then it expanded, and the people got skills in management and in advocacy, and developed into activities that led to safe housing in a large scale. And it's just an example of the importance of increasing democratic space, supporting decentralized decision-making, and involving communities, and making sure that women's voices are heard within that, within those debates. As I mentioned, there may be many barriers and many reasons why women are not able to participate. It may be difficult to get to and from the place, or they may be unaware or just accept the sexual harassment in public spaces as part of life. They may have difficulty with literacy. They may not be able to afford childcare or have other family or work commitments. They may just be afraid of speaking in public or lacking confidence. So all of these issues need to be taken into account to make sure that we really enable women's participation in a meaningful way. This is just an example from India of a slum upgrading program that was done by the Self-Employed Women's Association, SEWA, and it was funded by the World Bank and others. And it just, shows that a lot can be achieved. And lastly, to end, I think that making cities safer for women and girls ultimately makes cities safer for everybody. A city that promotes its citizen rights, including women, that implements actions to address violence against women, that provides assistance, that designs its environment to allow women to circulate freely and without fear, is a city whose society and local government are committed to the well-being of its citizens, and therefore a city that is safer for everybody. So thank you very much, and I just acknowledge that I borrowed a few slides from different people, and I look forward to the discussion. Thank you.